A breakthrough for people left to deal with hard-to-treat chronic nerve pain.
It's a tiny implantable electrode that CBS 2's Dr. Max Gomez says is very different from other pain blockers. He's here now with more on that. Doctor.
Yeah, that's right, Maurice. Chronic nerve pain is one of the toughest types of pain to treat. Painkillers, especially opioid painkillers, often don't work very well in the long run, plus there's a very real risk of addiction. Now there's a just-approved electronic pain blocker that's very different than other pain devices. Watching Matthew Magliaccio walking down the hall, you might think he's like many other 68-year-olds with a bum hip or knee. But here's Matthew taking the same walk in a pair of shorts. Matthew lost his left leg in a motorcycle accident 10 years ago, but his prosthetic leg lets him get around pretty well.
Well, I'm not in a wheelchair, and I'm mobile, and I'm walking, and I can look people in the eye.
Matthew still suffers a lot of nerve pain, though, including the odd phenomenon called phantom limb pain. His missing leg hurts.
My mind is saying, yes, you have pain there, even though I don't have that part of my body anymore. I felt like my ankle was broken or my toe was twisted.
Nothing gave Matthew much relief until he came to see Dr. David Spinner, Director of Pain Management at Mount Sinai, who decided to try a new pain blocker called a Bioness Stim Router. It's a tiny electrode, a small transmitter, and a controller that pulse small electric pulses into the nerves carrying the pain signals. Not just phantom limb, but all sorts of pain.
Pain often comes from hyperexcitable nerve fibers that are easy to fire. So by taking that away and making the nerve fire more normally, we're able to block a lot of the pain.
Unlike other electrical pain blockers, this device isn't inserted into the spinal column. It's placed directly on a peripheral nerve in a 15-minute procedure under local anesthesia. Matthew's had it for 2 months now.
Amazing. Totally amazing. Took away the pain.
Now, this isn't just for people missing limbs. The pain blocker can be used in the general population for most peripheral nerve pain after chest or hernia surgery, post-stroke shoulder pain, and phantom limb pain. Of course, hundreds of thousands of patients a year. And better yet, the pain nerves seem to change after long periods of the stimulation, so they actually don't carry the pain the same way. So you might get a long-lasting pain relief out of this. The pain nerves seem to kind of give up the ghost a little bit when you've been zapping them for a long time.
And no risk of addiction?
No risk of
Wonderful.
addiction. It's non-drug. It's pretty safe. The worst thing that can happen is it doesn't work.
Wow, like the off switch. Imagine that.
Yeah, exactly.
How about it? Thank you, Doctor.